I know that there are 4 main types of waste. The regular stuff like bottles and paper towels, chemical waste like germicides and cleaning solvents, radioactive waste, and infectious.
Well, fortunately, radioactive is one that we don't have to worry about. Riverside's a family practice, and any patients that need x-rays or cancer treatments would usually be referred to another facility. We can look at x-rays, but we don't take them here. Regular trash, like paper towels, usually go into a waste bin. Just an ordinary can. Recyclable things like bottles go into these special blue cans. The cleaning service picks those up at night, and they go in a dumpster in the back, outside. The town comes to pick them up. Chemical waste, like germicides and cleaning solvents, usually go into buckets, and then those are picked up by a different service outside. Infectious waste like this, anything at all that contains body fluids, goes into these red biohazard waste bags. Sometimes they're orange. Then the bags go into a special biohazard waste container. The container has a clearly labeled biohazard red symbol on the outside. These are also collected by an outside firm.
What do you do about the bags that break?
Well, if a biohazard bag breaks, the first thing that we do is we put a second bag around it. Don't ever remove infectious material from the broken bag. Could you open that for me, Joan? Needles and other sharp objects should be disposed of in a rigid, puncture-resistant container like this one. By the way, these are non-recyclable. Whenever you're handling sharp objects, keep the container upright and replace it when it's about 2/3 full. And never ever reach into the container or try to push anything that's stuck down.
That was underlined in the text.
Well, it should be, because you could really hurt yourself. Another thing that we should review is protecting yourself when you have to handle or be near bodily fluids. I know you've seen many pictures before and you've probably practiced it, but let's just run over some of the basic rules whenever you're handling any kind of bodily fluids. You need to wash your hands whenever you see a new patient or handle any kind of specimen. It'll become automatic. Gloves should be used whenever you're in contact with blood or other body substances, and always change between patients. If you're assisting in surgery or any time there's a risk of splattering, wear a gown or apron and a face mask or eye shield to protect yourself.
Besides the standard precautions, there are some common sense things you can do to protect yourself as well, like keeping long hair tied back, keeping your nails short, and not wearing excessive jewelry, and wearing shoes with a closed toe and a low heel that won't slip. Might sound simple, but that doesn't mean it isn't important.